I'm glad. I mean, that's my
Yes.
whole thing is I just want moms to feel comfortable and informed and know that they it's literally impossible for them to make a choice about formula that's going to ruin their kid. And I feel
Yeah.
like so much of the time that's the fear is like if they don't breastfeed or if they pick a bad formula that their kid is going to turn out somehow worse than they would have otherwise. And that's just not true.
Hi, everyone. Welcome back to another episode of the Gestational Diabetic. I am your host, Tracy Houston, and I'm here to inform you and empower you so that you can be a confident member of your healthcare team. As a quick reminder, none of the information on this podcast can be used to diagnose or treat any medical condition. If you feel as though you're experiencing any issues with your health, please discuss them with your medical provider. Today on the podcast, we have Mallory from the Formula Mom on Instagram. The reason I asked Mallory to come on is because I know that in the Facebook groups for gestational diabetes, there seems to be a lot of talk about moms not wanting their babies to have formula after birth and wanting to breastfeed. And, sometimes formula is necessary in circumstances with gestational diabetes because the baby's blood sugar might be too low or the mom might not be producing colostrum yet or whatever the situation is. And so sometimes the hospital wants to give formula to the baby to bring their blood sugars up to a safe range. And there's a concern about that from moms for many reasons, and Mallory talks about those. So let's jump into the interview. Hi, Mallory. Thank you so much for coming on the podcast today. How are you?
I'm doing well. Thank you so much for having me. It's a privilege.
Absolutely. So, yes, can you get started by telling us who you are and the work that you do?
Yeah, so I'm Mallory. I'm known on Instagram as at the Formula Mom. I'm a mom of two. I am a certified infant feeding technician, and I am a very passionate advocate for informed, feel good formula feeding for moms who choose that.
Cool. How old are your children?
I have a little girl who's 4 and a little boy who's 16 months.
Oh, how precious. I love that age. From like 1 to age 3 those are the great years. I love
It's
them.
so fun. It's fun to watch their personalities come out and you can start to like sort of see how their brains work as they're trying to figure things out. It's been really fun.
Awesome. Great. Okay. So when you said that you are an infant feeding formula, what technician? I'm sorry, I forget how it
Yeah.
went.
Yeah, an infant feeding technician. And so typically, these are folks that work in the hospital who prepare formula and make sure it's safe and deal with safe storage and selecting the correct formulas for different babies, make sure they're whatever the doctors are prescribing meets the nutrient needs of the infant.
Okay. So see, that's interesting. I didn't know that there was a variation in formula like that, to address different needs. I mean, you see the
Yeah.
regular stuff like fortified with this or whatever, but
Mm-hmm.
in my head it would be just like, regular milk. You have whole D or whole vitamin D milk, and then like soy
Yeah.
milk and all that. So,
Mm-hmm.
so formulas are actually formulated with different um, needs or health concerns in mind.
They are, yeah. So, and I think sometimes formula gets sort of a bad rep as being one size fits all, when in reality, there's actually a huge variation. So, all formulas are required to meet the same nutrient guidelines set forth by the FDA, but the ingredients that they use to meet those guidelines can vary really widely. So, you can have cow milk formulas, goat milk formulas. There's now a pea protein formula, soy formulas, and then they use different carb sources, and there are formulas that are fortified for preemies or have extra protein, all sorts of stuff.
Gotcha. Interesting. Okay.
Mhm.
Cool. So, what is your mission then as the formula mom?
Yeah, that's a great question. So my mission is to help moms formula feed with confidence without guilt, stress, and shame. And the culture that we live in, I think everybody expects to breastfeed. They know that that's the optimal first food for infants. They've heard it at their pediatrician, they've heard it from their OB, whatever. And there's a lot of support for breastfeeding. There's classes, there's lactation consultants, there's everything else. And so you have this sort of dichotomy where you have all this support, but then the CDC says that 80% of moms will end up formula feeding before their baby turns 1. And there's just no information out there. And so you have these moms who are often, sleep deprived, hormonal, exhausted, overwhelmed, and they're standing in front of the formula aisle and they're like, what do I do? And they don't have any good information. So that's my mission, is just to provide support and information for moms who might be looking to supplement or switch to formula feeding.
Right. Awesome. Yeah, and you're right. Your account is the first that I've seen like anywhere, on the internet.
Mm-hmm.
Yeah, there might be a couple articles or something like that, but there's no mission or no no place on the internet or anywhere dedicated to
Mm-hmm.
informing about formula. So
Yeah.
that's amazing.
Thank
Wonderful.
you.
So okay, I know from your Instagram that you had gestational diabetes.
Mm-hmm.
Which pregnancy was that in?
So interestingly enough, I was misdiagnosed with my first pregnancy. So I had failed the first 1 hour glucose tolerance test.
Okay.
And then I did the 3 hour and I narrowly passed. I mean, it was like right on the line. So of course my doctor was like, okay, well, you passed, but just, take it easy on the sugar. And I was like, I passed. And I was eating like donuts and Snickers bars the whole time. And so then when my daughter was born, everybody was like, whoa, you had gestational diabetes. Like my fluid levels were too high. My placenta was really calcified and aged. She was 7.5 pounds, 4 weeks early. So she would have been big, big, big. And her blood sugar was all over the place. So they were like, whoops, guess we missed that one.
I'm sorry, did you go into labor without medical intervention? Like, did you spontaneously go into labor?
No, I actually had a complication with my placenta. So they delivered her early scheduled. And then we were all grateful that she was early, since it was
Right.
obvious that she was about to have some significant complications from the uncontrolled diabetes. And I should have known, because my mom had gestational diabetes twice, and then I have an identical twin sister, and she had gestational diabetes twice. And
Oh,
obviously so much of it is genetic. And so I should have advocated, I think, looking back, for them to do another tolerance test maybe 2 weeks later in the pregnancy, because I think they would have caught it. But when all is said and done, she was fine, I was fine. We knew to be more careful next time. So then my second pregnancy, they did an early screening, which I passed, and then I was officially diagnosed when I was about 26 weeks. And he was so healthy, and it was just a much healthier pregnancy this go around, being able to monitor it.
cool. Yeah. Just a quick note on that for moms listening. A lot of people want to complain about being diagnosed with gestational diabetes, and then they often question whether or not they actually have it, because they're eating what they normally eat, and they're doing their blood sugar checks, and the blood sugars are within range and everything. But overall, even if it is a misdiagnosis, it's for the health of your baby.
Absolutely. Yeah.
Yeah. And it brings awareness too, because yeah, if you go on in your pregnancy thinking that you don't have gestational diabetes, and then like you did, you were eating
Yeah.
Snickers bars and stuff, then
Yes.
it could be so terrible. So just I guess some inspiration.
No, I agree. And I am now like an evangelist, especially on Facebook, where moms will talk about wanting to skip the test, or they
Yes.
don't think they need to do it because of XYZ. Like, other than my family history, which is a big risk factor. I mean, I wasn't of advanced maternal age. Like, I have a normal BMI. I eat pretty healthy, like generally throughout my life. It would have been easy for me to be like, I probably don't have it. It's fine. And so I'm now like very passionate about encouraging moms to take it seriously. And even if you manage to pass the 3 hour test, that means that your body's still not metabolizing that sugar appropriately, even if you pass.
Right.
So yeah, it's hard.
I know, and especially considering that blood sugars usually get higher towards the end of pregnancy. I can't talk today.
Yeah.
So yeah, just even if you do pass the test, still try to take
Hmm.
it easy because you never know. Things could switch and you not even know it
Yeah,
until it's too late.
absolutely. Yeah. I wish that there was more conversation among the general public. I feel like so many pregnant people view the glucose tolerance test as just something they have to get through.
Hmm.
And I don't think there's a lot of education about like why we do it. Like, what does it mean if your blood sugar is higher than normal? How do you maintain adequate blood sugar, all of that. So I'm thankful I learned so much through my gestational diabetes journey, even though, of course, it was, frustrating and stressful at times,
Hmm.
that I wish I would have known just generally about blood sugar and about, you know, carb composition and all of that.
Yes. So has having GD changed the way that you eat?
Yes and no. I will say, after my baby was born, my second baby, I literally think I ate like 13 cookies. Like I was like
Yeah.
in that postpartum room, and my father-in-law brought them, and I was like, all right. So I definitely went on like a binge right after, which I do not think is recommended. But
Yeah.
I think what I realized so much is how many carbs are in things that I had previously assumed were protein, like cashews.
Right.
Cashews have more carbs than protein. Um, and but it also made me realize that it was easy enough to make like smart swaps of like, okay, instead of a bagel I can eat half an English muffin, and that's going to be way better for my blood sugar, and it still feels like I'm eating a breakfast sandwich. Excuse me. And so I have definitely maintained some of those swaps,
Yes.
just because I know, generally speaking, a lower carb lifestyle is healthy for me.
Right. Yeah, I'm the same way. Like I love carbs. I mean, who
Oh,
doesn't,
I know, I
Just
know.
especially bread. Just every form of bread
Mhm.
is amazing. But
Yeah.
yeah, ever since having GD and then kind of
Mhm.
getting into it and really getting educated on it, and I'm looking at stuff and I realize how high blood sugar affects more than just, your
Yes.
blood sugars. It affects
Yeah.
everything in your body.
Yeah.
And so I'm like, well, I do want to be healthier. I do want to feel
Mhm.
good. So I try to be mindful when I am eating. But there are some days when I'll just
Mhm.
eat a candy bar because
Oh, yeah. And
and that will be the only thing I eat all day though, because I'm just so busy with other things. And then I'll be like,
yeah.
oh wait, I ate a candy bar
Yeah.
today. I really need to reel that back in.
Mhm.
Okay, so on your Instagram, when
Mhm.
you posted about having gestational diabetes, the graphic that you posted says gestational diabetes, why some babies need formula. And you
Mhm.
said mom's blood sugar is too high, the baby produces extra insulin, baby is born, extra insulin makes baby's blood sugar too low, and the baby needs formula to increase blood sugar quickly.
Mhm.
And that really caught my eye because I know it's often a conversation topic in the Facebook groups about how moms
Mhm.
don't want their babies fed formula if the blood sugars are too low, because they know that that is kind of a go-to or default option that
Mhm.
the hospital staff tries for when the baby comes out and tests with low blood sugars. And maybe they want to try that first instead of trying the mom's colostrum first or whatever like that. So can you just talk about that a little bit?
Yeah, absolutely. I think, generally speaking, a lot of, even in the Facebook groups, a lot of moms who have gestational diabetes or who struggle with blood sugar late in pregnancy don't realize that the big risk is low blood sugar in their baby when the baby is born. I think the general idea, a lot of people tend to think that, oh, if their blood sugar is high, their baby's going to be born with high blood sugar, when
Right,
in
right.
fact, their pancreas is working just fine.
Yes.
And so they end up being born with low blood sugar, because they produce so much extra insulin. So just like you would with a type 1 diabetic, if you're having a low blood sugar episode, you want to increase that blood sugar quickly using glucose. It's why you'll see, glucose tablets or those sorts of things in the pharmacy for people with type 1 diabetes. So, formula is just an easy and accessible way to increase blood sugar quickly. I absolutely agree that if you have access to colostrum, if your milk comes in and or you have, tried to collect some prior to delivery, if you have that available, that's awesome. What we do know, though, from the La Leche League, is that gestational diabetes can delay milk production. So
Mm.
you have this sort of double-edged sword where you have these babies who have low blood sugar and they need a sugar source, a carb source to get their blood sugar up. But then you also have these moms who have delayed milk production because of the gestational diabetes. So it sort of hits on both sides. And that can be really frustrating for a lot of moms because they want to, they want to give their baby what they perceive to be the best.
Right.
The big thing that I advocate for, though, is that, I realize that people have concerns about formula. They have concerns about ingredients. They have concerns about how introducing formula early might impact the breastfeeding relationship. But definitively, without a doubt, without question, giving a baby formula for low blood sugar is safer than letting them continue to have low blood sugar.
Oh, yeah, absolutely.
Absolutely. And I never want moms to feel like that's a choice that they have to make. And there's also a lot of ways that babies can be given formula that in order to raise that blood sugar without impacting the breastfeeding relationship. So they can use a medicine dropper, they can use a spoon even. They can use what's called a supplemental nursing system where they run a tube, down the side of your breast that feeds formula while the baby is attempting to latch. And so there are a lot of ways that you can use formula in order to remedy that blood sugar issue without actually damaging a breastfeeding relationship if that's what you hope to have. Yeah, it makes me sad that there's such a stigma that some moms would feel like that they might have to make a choice between whether to do something that their doctor is advising in order to help their baby,
Right.
and then they feel guilty about it.
Right.
It's unfortunate.
I know, yeah, there's so much emphasis put on breastfeeding, and that could really take such a strong mental toll on the mom. And that's another post that you made, is the link between breastfeeding and formula feeding and postpartum depression. So I forget the stat. Do you know how what the percentage was on that?
Not off the top of my head. I think the stat or the research that gets quoted a lot is that breastfeeding reduces the risk of postpartum depression because
Yes,
you release oxytocin and dopamine and all those feel-good hormones. But I think for some moms, the stress and the pressure of being the only provider of nutrients for this new demanding little human increases the risk. And I just don't think that's talked about a lot. And I think especially when you have moms that are feeling like pumping or nursing is contributing to their postpartum depression, they go to their provider and their provider says, well, you should keep doing it because if you keep doing it, it's going to reduce the risk. And it's like, no. I think generally speaking, there's just a lack of nuance in how some people interpret the research about, all of the benefits that you could get if you breastfeed, because it really just depends situation to situation, person to person.
All right. So what are some myths about breastfeeding that you like? What are your favorite ones that you love to just dispel?
There are so many. And I will say up front that all of this is linked in my Instagram page. So if you're like, okay, this lady's saying this, but what's the research say? I have a bunch of posts on my page called Formula Myths and then the number. If you click on those posts and then go to the link in my bio, it'll link to the research. So always want to make sure that people know that what I'm saying is research backed.
Right.
So basically, the big myths that I see that people talk about and that are sort of weaponized to make moms fear using formula in order to try to encourage them to breastfeed are that formula will cause obesity, that formula will cause a lower IQ, and that formula is poison. Those are the big ones. For obesity and lower IQ, the challenge with the studies that people cite when they're talking about these things is that they don't look at familial relationships. So for the study, and there was a study, it was done, I think, in Denmark back in the 90s that said that babies who were breastfed had a higher statistically significantly higher verbal IQ scores. So everybody freaked out and they were like, oh my gosh, like if we don't breastfeed, all of our kids are going to be like, multiple points lower in IQ. But they didn't control for the mother's IQ. And so when they asked or tested for the mother's IQ, and then they, sorted through all of the data again. What they found was not that breastfeeding led to higher IQs. It was that the moms who had higher IQs were more likely to breastfeed. And I always say that gets into a whole big thing about like opportunity and socioeconomic status and everything else, paid maternity leave, and it's all wrapped up. But yeah, so ultimately what the research found is that the biggest factor of your child's IQ is your own IQ, and that people with higher IQs tend to make different choices for their kids because they have different opportunities. And so it's not the formula or the breastfeeding that's going to impact your child's IQ. So that's IQ. When we look at obesity, the same sort of thing happened, which is that, they pulled a bunch of data from longevity studies and found that kids who were formula fed had a higher rate of obesity in adulthood. Okay. However, once they compared that within sibling sets, where one sibling was breastfed and one was formula fed, there was no longer any statistical significant difference. And so again, they concluded that it wasn't the formula that was making these people have a higher likelihood of obesity. It was that families who formula feed also tend to engage in other risk factors for obesity, which again goes back to socioeconomic status and opportunity and all of that. So I think a lot of these things are just sort of cherry picked data to make people feel bad. And I will say also, for anybody who's listening, if you want to breastfeed, I think that's awesome. And I will absolutely agree that I think when it works for you and when it works for your baby, breast milk is the ideal first food for infants. You will never hear me say that formula is better than breast milk. I don't think it is. I do think it's a safe and functional alternative for moms who can't breastfeed or don't want to breastfeed. So that's sort of my my spiel, but there are really a lot of myths. I'll say one other thing that drives me crazy, which is that sometimes you'll hear people say, oh, if you formula feed, your baby is twice as likely to have ear infections. And you're like, oh my gosh, I've doubled my kid's risk. This is terrible, whatever. But that is total risk. That's relative risk instead of total risk. So yes, maybe your baby is twice as likely to have an ear infection, but the risk goes from 2% to 4%. So when you look at that total risk, it's still really low. But no one talks about that because that's not as fear-mongery as saying you have doubled your baby's risk. And you're like, okay, well, 2 to 4%, like, I think I can get comfortable with that. Like, that's not, like, that does not increase the risk as much as you try to make me feel like. So I'm all about, trying to help people understand what the data really says.
Yes, I love that. That's, I don't know if you know about evidence-based birth.
Yes.
Yes, I love them, right? And I recently read that in one of their articles that, when doctors talk to patients, a better way for a doctor or any professional to talk to a patient is not in terms of you've doubled your risk or you've cut it in half or something like that. Like, use actual numbers. Like, in a study of 10,000 people, 4,000 had blah, 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 or, you lowered your risk by 2% and, stuff like that. So, because that makes a big difference and it really brings things into perspective.
It does. Yeah.
Especially when you're talking about, like medical interventions, that has to do with complications, with health, with money, with time, with availability. There's so much to factor in.
There's so many factors.
Right. And so when you are able to really put things into perspective by real, actual numbers, then a lot changes.
It does. And I think it helps people feel empowered and helps them to make choices that they can feel confident about.
Right. And that's what we're all about. We are trying to empower moms so that they can feel confident about the decisions that they make.
Absolutely.
Cool. Okay. Now, yes. Okay. So when it comes to formula feeding, what are some common questions that you hear? I know you probably already covered them, like with the myths, but are there any other common questions that moms usually ask?
Yes. So I get sort of questions in a couple of different buckets. I get questions about just formula feeding basics, things like, after I make a bottle, how long is it good for? And how do I store this formula? And do I add the water first or the powder first? And all of that. And again, it just goes back to, it's crazy that there's so little information that, pediatricians and hospitals are sending moms on their way and, without really basic safety information. So
Right.
I'll do a quick run through of that, which is that if you're using a powder formula, you always want to measure the water first and then add the powder. You want to stir the bottle instead of shake it if possible. Shaking causes air bubbles, which can create extra gas in your baby. So stir if possible. And then it's good for 24 hours in the fridge if it's unused, prepared but unused, 2 hours at room temperature, and then 1 hour after it's touched the baby's lips. So got to toss it after an hour once you've fed it to baby. But if you haven't yet fed it, it can stay at room temperature for 2 hours or in the fridge for 24. So those are your general.
I'm sorry, is that because of saliva touching it? Okay, gotcha.
Yeah. There's bacteria in the baby's mouth, which can contaminate it if we allow it to grow in the formula over time.
Okay, cool.
Yeah. So those are the general questions I get with formula basics. The biggest question I get is, how do I know what formula to choose? We talked about earlier, there are a lot of different types, and there's also just a lot of different brands, and it's hard to separate what's like marketing versus what's valuable versus, you can get a formula for $18 or you can get a formula for $44. And is there any real benefit to that? And I don't blame moms for being super overwhelmed. So some tidbits that I give for moms who don't know where to start is that you want to look for a formula that has lactose as the carb source. And I think that this will likely be interesting to your followers as it relates to diabetes, which is that lactose, as you all probably know, is a slower acting carb than glucose or sucrose. That's why a lot of us are able to do ice cream for some reason, even if you have gestational diabetes, because it doesn't, the lactose doesn't metabolize as fast. It's slower on the glycemic index value compared to corn syrup solids or sucrose table sugar. So you want to pick a formula that has lactose if possible, because that's the carb that babies are biologically designed to digest. It's the carb source that's in breast milk. So if you can find a formula that uses lactose, that's preferable over corn syrup solids or sucrose.
Okay.
So that's number one, lactose. Number two is that you want a formula that has added whey. So the protein composition of breast milk is different than the protein composition of cow's milk. Breast milk has more whey protein and cow's milk has more casein protein. So if you're using a formula that is cow milk based, you want to make sure that it has whey listed in the ingredients list, because that means that they have added whey to make the formula more closely mimic the composition of breast milk, which means that your baby's going to have an easier time digesting it. So lactose, added whey. And then I typically recommend looking for a formula that has DHA, which is an essential fatty acid, good for brain development. That's abundant in breast milk. We want it for babies if they can have it, as well as pre and probiotics, which, prebiotic fiber, and then probiotic, good, healthy bacteria to help develop the gut microbiome. So those are the four that I recommend: lactose, whey, DHA, pre and probiotics. I'll also give a shout out that I have a formula guide that is free that folks can download from my Instagram bio, and it has all of the formulas that I personally would recommend and use based on different categories. So if you're looking for a formula for a brand new baby, if you're looking for a formula for a baby that's really struggling with reflux or constipation or whatever else, I have all of those built out in this guide that people can download.
Wonderful. Yeah, because I was going to ask if you had a favorite brand. So, no, it would be better to refer them to the guide for their specific situation. But so what about, you mentioned lactose. What if a baby is lactose intolerant? Is there something else that they should look for there, or just nix that?
Yeah. So this is actually another huge myth. So because I think it's like 40% or something of adults have lactose intolerance, parents tend to assume that if their baby is struggling with a formula that's cow milk based, that their baby has lactose intolerance. In fact, lactose intolerance in infants is super, super, super rare. And that's because lactose is the primary carbohydrate in breast milk. So babies are born with the lactase enzyme because they're meant to digest lactose in breast milk. Most of the time, I know, right? It's like things that you didn't know. So most of the time, if a baby is having an issue with a cow milk formula, they're actually reacting to the protein in the cow milk and not the lactose. So there are a variety of formulas that offer either, it's called partially hydrolyzed, broken down milk proteins that are easier to digest, or you can get a hypoallergenic formula, which has really pulled apart the proteins until they're, the body doesn't even recognize them as a protein that it could react to. There are also, it's called elemental formulas that are just based on amino acids instead of proteins. So there really are a lot of options. And I will say there are some babies that have lactose intolerance. It's a condition called galactosemia, but it's rare. So I always caution folks, if they think their baby is lactose intolerant, check with their pediatrician and make sure it's not actually a milk protein intolerance, because that's more common and it's also easier to treat.
I see. So when it comes to babies getting formula, whether it's be like, right after birth and they're still in the hospital, or later on the pediatrician recommending it or whatever, how would a mom find out if how would the mom know if the baby is struggling with something in that formula?
Yeah, that's a great question. So a couple of things that we look for that indicate that you would need to switch formulas. First is if your pediatrician recommends it. Always listen to your pediatrician, follow up with them. If your baby has an excessive amount of mucus in their stool, that's generally an indication that they're reacting to something, likely the milk protein in a formula. If there is blood in the stool, and sometimes pediatricians will actually run a stool test to look for trace amounts of blood in the stool, that's an indication. Obviously, if there's been a recall on the formula, you want to switch. Or to a lesser extent, if your baby develops a rash, if they have really excessive spit up or vomiting, or if they're really struggling with constipation. And babies, especially formula fed babies, can go up to a week without pooping, and it can be normal as long as sort of the consistency of the bowel movement is still soft. But if a baby is having really infrequent, really hard poops, then we generally want them to switch.
Okay. So, I mean, do pediatricians and the hospital staff, do they consult with someone in your specialty to, kind of figure this out? Because like you already said, that there's moms walk away with a lot of non-information, so to speak. They walk away not being informed. And I would think that the hospital staff, either they probably just don't know that there's that much information to give. So is your specialty like in a hospital? Are they employed? Okay, so do moms get to talk to someone like you? No.
Typically not. And I wish that that was the case, that, formula feeding consultants would be offered like a lactation consultant is offered.
Right.
Typically, feeding technicians are sort of in the background in a sterile lab where they can prepare formula and, talk to providers and things like that. Something else that makes it tricky for moms is that hospitals and pediatrician practices tend to have agreements in place with certain brands. And so if you go to a hospital that is partnered with Enfamil, your choices are going to be Enfamil options. And Enfamil certainly has a lot of great options, but they don't have all of the options. And so sometimes the information that you get from your providers is biased in that way, where there is a monetary incentive for them to recommend something, which is not always what's best for moms. And that's not to say that they're going to recommend something that isn't good, but just that you might not get the full picture because of that monetary incentive, which is a bummer.
Right. Gotcha. So when it comes to marketing and packaging of formulas, have you found them to be fairly truthful, or is there a lot of deception in formula marketing?
I would say it's a little bit of both. So, the big thing that I see is that brands are obviously doing whatever they can to sort of differentiate themselves from the noise of everybody else. What you don't hear talked about a lot is that all formulas have to meet the exact same nutrient requirements set forth by either the FDA in the US or the European Commission in Europe. So if you look at a formula, it doesn't matter if it is generic brand from Walmart or if it is the most expensive formula that you can possibly buy, organic, Whole Foods, whatever, they have the same nutrients because they're required to. So, because of that, I think a lot of moms don't realize that any formula is as safe and functional as any other.
Got it.
I think sometimes what you see in the marketing, which I really hate, is this term closest to breast milk.
Yes.
And that, it pulls at mom's heartstrings because they want to feel like, okay, well, if I'm not giving them breast milk, I want to give them what's, second best or what's, just slightly under in
Right.
terms of quality. And I think that that's a lot of marketing because, as we talked about, most, all formulas are going to have the same nutrient profile. I do think that you can make choices that get you closer to breast milk, like using lactose as the carb source and like having added whey and like having those other DHA and prebiotics, probiotics that I mentioned that are in breast milk. But I think that phrase is generally a marketing ploy. Most formulas and most formula companies have those things if you just look at the back of the ingredient list. So the last thing that I want is for moms to feel guiltier. Like if they already feel guilty, they're formula feeding. We're trying to combat that. But then they feel guiltier that they, have to use a generic or they have to use whatever WIC provides or whatever. The idea that some formulas are significantly better than others, I think, is marketing.
Right. Yeah, I remember seeing when the first time that I saw closest to breast milk, my kids were both, they weren't formula feeding anymore.
Mm-hmm.
And so, but when I saw it, I got so upset about it because I pay a lot of attention to marketing and I am really big on truth in marketing. And so when I saw it, I was like, oh, you're probably lying. And, and so I was like, I would never buy that. But
Mm-hmm.
no, you just, I mean, you completely just, I mean, I know I'm not fully informed, but I feel so much better about, when I have my next child, like I can take the information that you gave and really make an informed decision and feel confident about it.
I'm glad. I mean, that's my
Yes.
whole thing is I just want moms to feel comfortable and informed and know that they it's literally impossible for them to make a choice about formula that's going to ruin their kid. And I feel like so much of the time that's the fear is like if they don't breastfeed or if they pick a bad formula that their kid is going to turn out somehow worse than they would have otherwise. And
Right.
that's just not true.
Yeah. Awesome. Great. Well, if is there anything else that you wanted to say or any reattach you wanted to go over?
I don't think so. Just I appreciate the opportunity and just would encourage your followers and fans that if they are interested in this and they want to learn more, definitely follow me over on Instagram at the Formula Mom. I'm also in the process of building a website that's going to have some resources, which will be theformulamom.com. And also, if you're listening to this and you're in the middle of gestational diabetes, it gets better and you're doing a good thing for your baby. And one day you too might eat 13 cookies in the postpartum room. I don't
Absolutely. Pack the bag beforehand.
know.
Okay. Well, thank you so much for coming on.
Thank you for having me. I really appreciate it.
Okay, Mama, that was some awesome information, right? I hope that you found it helpful. And I know that formula feeding might not be your thing, and it might be something that you're just staunchly against, and that's okay. This episode was to help the moms who feel pressure about staying strictly breastfed, or maybe, just had uh, a stigma against formula feeding from myths that are out there in the atmosphere and just straight up miseducation. And so, it's always good to talk to an expert about things because the truth of the matter is our doctors don't know it all. It's always great to get information from a person who knows the ins and outs and works in the specialty and can really give the information that we need to make an unbiased decision for ourselves and for our babies. So I'm going to link to Mallory's Instagram in the show notes. That's all I have for you this time. I'll talk to you later.